Hi everyone, my name is Lisa Clarkson. I'm the owner of Dancing Tree Physical Therapy and Wellness. I'm a physical therapist, a functional medicine practitioner, and also have been a movement educator for many years, teaching dance as well as Pilates, and of course telling my patients their specific exercises, and even in functional medicine because movement is part of a whole health plan. Today I'm going to go through a lumbar mobility series, and then go into a lumbar stabilization series. This should be a feel good, available for everyone. I'm going to talk you through modifications if you need them. And all you need to start with is a mat. Or just a carpet or whatever, something to lie down on. So we're going to start on our backs, and you want to try to orient yourself to what your neutral position of your spine is, and that's going to look different on everyone. But neutral is when we have the natural curve of our lower back. And neutral should also be a pain-free and tension-free position. So if you lie on your back and it doesn't quite feel right, you might tilt your pelvis slightly one way or the other until you don't feel any discomfort. Also, lying here, if you feel like your head is dropping back in space, you could put a little pillow or a towel roll under your head so that you can be in more neutral. Using Pilates principles, neutral is also about the position of your rib cage, so we just want to make sure the ribs aren't popping up to the ceiling like that, and we want to make sure the shoulders are open. But again, this is going to be focused more on sort of healthy lumbar spine or low back. We're going to start with a pelvic tilt, so you're just rocking your pelvis towards a flat back position, and then you're going to rock your pelvis into an arch. So your back is flattening out on the mat, and then you're sort of arching your back in the other direction. And I use the image of a clock to help with this. So if I orient the clock sort of around my pelvis and abdomen here, 12 would be up towards my belly button, and then 6 would be down towards my pubic bone. And so far, I'm not really using or thinking about what muscles I'm using. I'm just kind of pushing with my feet, rocking back and forth. And this could be as extreme or as discreet as feels good to you. And then keeping with the idea of a pelvic clock, then I'm going to rock my pelvis from side to side from 3, and then over to the other side to 9. And there is a reflection of this movement in my legs. I'm sort of thinking about tracing this line on the back of my pelvis from side to side. And again, it shouldn't create any discomfort. I'm not going all the way out and lifting one butt cheek up. I'm really just rocking gently from side to side in as easy and sort of tension-free mode as I can. So we're just introducing a little bit of movement around our pelvis and around our lower back. And then we're going to carry on with still this idea of the pelvic clock. We're going rocking to 12, and then we're going to circle around. So going 1, 2, out to the 3 where we were before, circling down to the 6, coming up the other side from 6 to 9, and then returning to 12. And then going the other direction. And again, it may be that your back is a little bit stiff, and so you can't really feel that you're touching all of the parts. You know, if we were trying to be really specific, we would think not just about the hours, but maybe the minutes and seconds. So you're trying to make a very, very smooth circle around. And if you're watching the video, right, it kind of looks like you're not doing much at all. But when you're lying here and moving through those little ranges of motion, that can be very therapeutic to a stiff back or a painful back. And then in order to just get this movement to happen, you might end up with a little bit of abdominal engagement without even really trying. So you should have done clockwise and counterclockwise a few times, and we'll come back to center. We're going to do one more of these pelvic clock movements, and this one, I will admit, is a little bit challenging to feel in your body. So we did the 12 to 6, and now I want you to try to feel where 5 would be, which would be just to the left side of your tailbone. And then you're going to try to rock just to 11, so it's just to the other side. So we have this very narrow diagonal of our spine, rocking down. I'm slightly arching my back, but there's more weight on that left side. And then I'm rocking up towards that 11. And I'm trying to feel that smooth diagonal, but it is an unusual pattern, so it may feel that when you do this, you can't really tell if you're quite doing it right. And that's okay. You're just going to repeat it. And again, if something bothers you, if you feel tension or pain, then maybe you adjust it a little bit. You don't arch quite as much. Maybe you don't tuck quite as much. Maybe you keep it even smaller with the movement. And you could also try adding a breath, so maybe inhaling as you go to the 5, and then exhaling as you go to the 11. And then let's try that on the other side. So you would, again, not be on 6, but just to the side of it to your 7. And then you're going to rock up just to the left side of your spine by your belly button or a little bit below the rib, and then back down. And you're rocking back and forth there. And again, from the outside, you're watching this right on the video. It's like, what is she doing? Can I even see anything? That's why I'm trying to use so many words, because you can't necessarily see it unless the camera was from above. But the idea, especially in these funny narrow diagonals, these are called P&F patterns, proprioceptive neuromuscular facilitation. I know it's a big word and we don't have to memorize it, but these diagonals, or these three-dimensional patterns, are actually more like what we do in functional movement. So when we're moving through space, we're often not just in one plane at a time, we're in multi-planes. And when you go through this diagonal, there is a little bit of a rotation. There's a little bit of arching and tucking of the back. And there's a little bit of an up and down movement. So you're getting multiple planes. All right, so let's just rest there in the middle and see how that feels. And hopefully that feels really good. So we're going to do a couple other nice little mobility things. We're going to come up onto all fours. And we're going to do a little cat-cow. So when we do cat-cow, you want to make sure your abdominals are engaged. You want to make sure that you're not sinking down into your shoulders. So you press the floor away. And then we can use the breath. On the exhale, you're going to rock from tail to head. So I'm trying to articulate my spine, initiating with my tail dropping, rounding my back. And then I probably inhale here. And then on the exhale, I'm going to articulate, leading with my tail, rolling through my lower back, my middle back, into my upper back, and then finding a little extension. Now, most people need to be careful they don't just like sink into their lower back. Most of us kind of exploit our lower back. So you're having an arch, we're trying to make it through the whole spine, but most of us need to work more on moving our upper back. So again, try that, dropping the tailbone, lifting the hip bones, the belly button, the ribs, the heart, and then rounding down. Inhale there, and then exhale, sequencing, lengthening. I'm letting my shoulder blades glide slightly in. I'm letting my shoulders roll slightly open so I can lift my sternum, and I have my belly engaged. My abdominals are engaged to support me. Rounding the back and sequencing. Try not to overwork. Inhaling there. And then arching. So this is like just non-destructive, repetitive movement. Nothing should be bothering you on these. We're just trying to get a little bit of lubrication in the joints, a little bit of muscle engagement, a little bit of spinal articulation. And then one more there, lengthening out. So a little cat-cow, and then if it's available to you, you can sit back. This is called a shell stretch because you're round in your back. For some people, that's going to feel really nice on the lower back. I'm imagining I have a bowling ball underneath my stomach here. And then, of course, you could also try doing like a child's pose, opening your legs a little bit, lengthening through. You'll get maybe a little bit more of a lat stretch, a little bit more length in the spine, and maybe a stretch in your hips. Either one is going to be good. It's just going to be different things. And then we're going to come out of that. So we're also going to do a spinal rotation here. This will be side lying. And as I mentioned in the cat, oftentimes our lower backs bother us because we do too much movement in the lower back and we don't do enough with the rest of our spine. So this is meant to help us move our upper back and get more mobility there, and then we'll focus on stability down in the lower back. So you can do this with the legs bent. You could even tuck your legs in, which will make your lower back round, and then it'll be really hard to rotate through it. So if your back is bothering you, I recommend tucking in. Then we're going to be reaching the arm up, and you're going to rotate. Now you want to turn your head, your neck, your chest, your ribs, and let your arm hang down. And then you're just going to breathe there, inhale. And exhale there too. See what you can let go of in terms of tension. And then reaching back up. And rotate back. So the thing is you could just let the arm go, and you might feel a stretch in your pecs. But what we want to do is turn our chest. You want to be careful you don't arch your back, so you may need to have a little bit of abdominal engagement. But think about allowing all 12 of your thoracic vertebrae to move. And then once you get into that stretch, then breathe and allow your body to soften. And then maybe as you come back, you want to engage the abdominals again, just for a little bit of support. We'll do one more there, reaching up and rotate. And then inhale. And exhale. And then reaching up and close. I also like to do a different variation where you sweep the arm overhead and you rotate instead. It's like a dial of a clock. And then reversing that rotation. It's a slightly different stretch through the pecs. You'll get more pec minor, pectoralis minor versus pectoralis major. And it helps you elongate as you rotate. So you might play with that. I'm going to go to the other side so we can do that on the other side, and I'll demo that version for you on the other side. But we're just doing about 3 on each side here. But of course you could linger on any of these. So sweeping up on the inhale, spiraling and rotating on the exhale. Being careful not to arch your back. Inhale. And exhale. And then reversing. And close. Now, we don't want to have the pelvis moving so much in these. So I don't want to turn my pelvis like that. But there's going to be a little forgiveness in this, because if we lock ourselves down, there'll be more shearing between our joints, and that's not really what we want. So allow for a little natural movement. And then reversing and close. And then we're going to do one more here, sweeping up on the inhale, rotating on the exhale, or maybe you wanted to keep yourself balanced, right? So you did the other version. Inhale, exhale, and then reaching up, and then close. All right, so that was a little mobility series, and I hope you enjoyed that. Now, if you're feeling warmed up, I'm actually going to do a second video right after this one that's going to focus more on stabilization. So it's going to be good to first get yourself loose, get your joints lubricated, get a little comfortable, and then follow it up with some stabilization so you feel supported. So hang tight, or just